yourself and to protect others is wearing a mask, washing the hands, trying to stay distant if possible, cleaning and disinfecting, and making sure that you don't come across anybody else if you're sick. Stay home if you're sick.
Okay, that's all I got. Thank you.
Ms. Bearkeller, Lydia. Lydia.
Could you hear me?
Yes,
Hello?
Yeah.
Okay, so I guess my comment is that CDC is here and the whole world is doing trial by error on this pandemic virus, and there's no solid evidence on how to cure this virus. But coming back to our reservation on this OGLALA Sioux Nation, I was bringing up the fact that the data that we're talking about, I think the OGLALA Sioux tribe needs to take ownership of our data, and that they're not used in any other way or any other form except to benefit the OGLALA Sioux tribe and its members. I know IHS does, and IHS does a report, but that's a separate government entity that does those. So I think we still need to make this, take ownership of our data. And then the differences in how it hits our people. We were reading some cases out of Atlanta, and about how it affected the younger generation, the younger kids, the high school kids, the grade school kids. And I would like CDC to kind of expound on that, on how those cases were different from what we're up here in the Northern Plains. And then with the governor saying that the younger generation, the younger kids cannot get it at all. I think that's totally false. However, I think our people need to hear the differences between, and then now they're trying to label it as a gene, as the genes in the body and how it affects and how it attracts the virus or how it comes to people. I don't know how true that is, but there's an article out there on that. So I'd like to CDC to answer their information on the on both of these instances or these examples anyway.
Okay, great. Thanks for the question. First, just to say that I looked at a report this morning that said about 90 children in the United States have died from COVID-19. And generally in a year in the United States, about 100 children die from influenza. So it is on the same scale at the moment with children. So they definitely can get infected and can die from this disease. In terms of the difference, how it impacts different ages of children, I don't have that data for you, but when we come back next week, I can get you some more information. So I'd be prepared to present that to you, but I just don't have that information right now. What I can tell you is that there are cases in some of the schools that have gone back to school. There have been cases now in a number of those schools, both among the students and the teachers. And also there have been, cases, deaths in children as well. There's also a syndrome that children seem to get, which is multi-inflammatory system disease in children. And while that doesn't necessarily kill children, it is a very serious disease that puts them in the intensive care unit. And there have been hundreds of cases of that in children in the United States since the COVID epidemic began.
Okay. And thank you for that information. And then working with our task force medical team, I believe that we really do need a procedure for communicating because, you know, we're trying to do this HIPAA law and using HIPAA and to try to look at protecting the patients, which is good, and I agree. However, if this communication and streamlining, like the schools are going to open, the schools need a process on how and who and where they could help, give more help to the families in terms of a student, and then turning that around and then having the protocol for every school, which they are doing, and to but well, we don't want to shut the whole life down, you know. There's still life here, and there's still, we still got to continue with our education and our day-to-day stuff and our traveling and the essential stuff. And but we would like that kind of support where we could streamline and be confidential, apply HIPAA, but also that every entity that should be involved needs to be aware. And how do we do that? I think that's a big thing that we need CDC's guidance in there, because it will really it be appropriate for our region, our reservation here. So that was one thing that I'd like to see happen before you guys leave on the 20th, and the new ones coming in gonna stay here forever. And you, as CDC, are you looking at this virus to end December 31st, like every, you know, every political uh, statement that's out there? Are you guys looking at it as it being lifted by this virus is going to be all gone by December 31st?
So
Thank you.
thanks for that. So I think we'd all like it to be gone tomorrow, but unfortunately, that's more wishful thinking than reality. So nobody's estimating yet at CDC when we think this will be gone, but it looks like it's going to be here for a while. So, you know, we're trying to help everyone see how they can best live with this disease being present. And I think some of the challenge has been that people have presented that you either protect yourself from the virus or you go out and you do things. You know, it's an either or, but that's not actually the case. What we need to be thinking about is how do we reopen things in the safest way possible? So how do we do both protection of individuals, protecting your health, while also allowing for some semblance of your normal life to come back? And that's where the risk mitigation comes in. So, you know, with schools, we would like to share that if you do these kinds of things, that's going to be lower risk than if you do other kinds of things. And so then you, the education committee, the tribal council can come back together and make a decision about what seems to be the best decision to make for all of you based on those risks. So the lowest risk is to do all virtual learning. The highest risk is to go back to the way things work. But there's things in between that you can do that isn't one or the other. And so we can help lay those out for you, help provide those recommendations, and then you all can decide what makes the most sense.
Sonia?
Thank you, Mr. Vice President, and good morning to our CDC guests this morning. And just want to say thank you for coming today and sharing, you know, all of this, the information on this new virus that we call COVID-19, coronavirus. And it's really good, I guess, to hear that you have been invited to come down here to our reservation and help provide training and technical assistance to the various entities on the reservation, mainly our task force. And I'm really glad you touched on the casino as well as the schools. And also within our reservation, we have all of our programs that also need to be educated about this COVID-19 and how to, to implement, this plan that we're looking forward to, hoping that we can get out there. And because school is starting, there's a lot of questions from parents and coming to the tribal council. But I'm really glad to hear that our schools are all implementing their own plans. They have their plans in place. But I think with, just providing some technical assistance to them would also help them to get that education out to the children and the parents. So I'm really glad that you will do that. I also, been listening here, and I also hear the three things that CDC always recommends: washing hands for 20 seconds, wearing your mask, social distancing. And you talked about the uh, the 14-day 14-day quarantine process. And I really would like to touch on that a little bit. You talked about quarantine and isolation. 14 days is good, you said. You know, after that 14 days, once you're off of the quarantine, some of the employees within our tribe have been asked to test before you come back to work. So they may take a test, and the test may come back positive. So there was nowhere in the I've never heard CDC say that. What's the next step after that? And I talked to our attorney within the task force a while back on this, because, as tribal leadership, we get these calls from our constituents in our districts that also have those concerns or questions, because they're the ones being asked to do that. And all they say is, well, we were told to do a 14-day quarantine, but now we got to take a test to before we go back to work. Then the second part of that is, let's say it comes back positive, then they tell them, well, now you have to be on quarantine for 10 more days. And it's kind of upsetting our some of our people, because they've been in quarantine 14 days, then they got been told that they got to be on a 10-day quarantine. And so, I really don't know today if our task force, and I also want to thank them too for really working hard to put a plan together to help our people across the reservation to understand about this very serious virus. And I think that I want to say that today, uh, I feel for our people out there today, because they need to really be educated about this virus. And, I want to let CDC know that as a tribe, we're very unique in our own way, because we have our culture that we fall back on, and our people out there, speak, some of them's first languages are Lakota language. They might not understand a lot of the things that today, what we're telling them. So that education needs to be put out there in our own Lakota language to tell them that. So those are things we share with the task force, or we share with I shared with the attorney. So when these questions come to us about another 10 days of quarantine, what is the CDC's recommendation on that? Because I did talk to the attorney. She said, well, during that time, they might still be shedding that virus. But then at the same time, we have the Indian Health Service saying, well, they're not they're not at that point where they shouldn't be told they cannot go back to work. Now, this is what was told to me by one of my tribal members. And he said, doctors, what he said versus what the task force said was different. So our Indian Health Service is following the CDC guidelines, is what he was told. This is how we follow it. I'm a doctor, and this is how I look at it. At the same time, we have our task force that looks at it another way. And this is one thing that I want to share is that with the attorney, her and I talked, and she said, well, because our population is very vulnerable at this time, because Native Americans, minorities are at a higher risk of getting this virus. And so we have to protect our people. So that was understandable to look at it that way. But I think that educational piece has to be put out there to the people to understand that. So I don't know if that was part of a recommendation that maybe they shared with you, but what is CDC's recommendation about that? Once your 14 days is up, then uh, if you test positive, you can't go back to work. You got to be quarantined for another 10 days. Is that written somewhere in your CDC guidelines somewhere?
Yes. So
Okay.
again, our guidance is guidance, and so recommendations. What really we recommend is that you have an established, agreed upon protocol here that everybody follows, so that it's not well, I heard this CDC said this, or I did that, but here's what we've agreed is the process for the tribe. But I can send a link to the recommendations for CDC. So isolation is for positive patients. So if you're recommended to be put into isolation, it means that you have had a positive test. If you go into quarantine, that's because you've been in contact with someone who's positive, but you have not tested positive yourself. So that's the difference in those definitions. And for isolation, we recommend that isolation can be discontinued 10 days after symptom onset. Now, I understand that the recommendations in the tribe are 14 days, and that's fine. It's a little bit more stringent than CDC's recommendations, but it's up to you to protect your population. And if you feel that having a few extra days is more helpful, that's additional to what CDC's recommendation is. And actually, we do say in our recommendations that individuals who have severe illness could transmit virus longer, and we suggest maybe up to 20 days for severe infections. So again, I think you have to determine what makes sense here for you and your population, but we recommend 10 days after symptom onset for positives. We do not recommend a test-based strategy to discontinue isolation. So once you've undergone, if you did test positive and then you undergo your isolation, we do not recommend additional testing. But then for quarantine, I'd have to look up those recommendations, and there may be something on testing. So let me look that up, and I will at the next meeting, or if helpful, I can send a link to you after this meeting with that information.
Okay, thank you. Thank you. I'm glad that you say that about the not retesting. And also you talked about the 10-day, because I think that's what IHS was also looking at, 10-day. But then as a tribe, we're following 14-day. And I think that we educate our people on the 3 things that CDC is recommending. I think over and over and over, that's being put out there. And I've shared a lot of what I kind of had to deal with, because I've talked to people that were the actual positive COVID-19 tribal members that would call me and talk to me about the things that they had gone through. And I think one thing that I really want to share today, and maybe this would be a part of our task force's part, and I'm glad that we did put on a COVID-19 director, Mr. Owe Zephyr, So I'm hoping that he would take this on too. Is our people across the reservation need to be educated about this COVID-19, and I think that in a good way. You know, right now we put it out there like we know it's a serious virus and that it can kill you. So everybody's scared of it. Nobody wants to catch it. That's the kind of mentality we have out there today with our people. But there's another side to it, is that the people that do have it, you know, and I'm glad Ms. Berkula brought that up about the HIPAA laws that we have today, is that we need to respect those HIPAA laws based on our people, because they are the ones that we need to protect, and we need to make sure that they are isolated if they're positive, or if they're been, you know, next to a positive person, then they're on quarantine. But those need to be put out there in a good way by education of our task force, in a good way, meaning that you don't push them away, or you don't treat them like you're scared of them. You know, I think that that's the piece that I wanted to touch on today, because our positive COVID patients are being treated that way, and they're not very happy about that. We live in a neighborhood cluster of homes sometimes where people, if they have it, are going to go outside their home and they want to take fresh air. Sometimes you get calls from the community saying, well, they're outside. Are they supposed to be outside? I mean, I found out that they can go out and take fresh air. If they have a garden, if they have something around their house they want to do, then that's fine. They can do that. But that's the education we need to get out to our people across the reservation. And we have some good people that sometimes get on the radio, and it's got to be, and I'm glad our task force is on and they're listening, is we have to make sure that the educational piece needs to go out to our people. In Lakota, we talk about, we have values. Compassion is one of them. We need to stress that a lot, because you don't know what these people are going through. It's a sickness that is here. And like you said, we have to work through it. Our lives have to continue. But every day you turn on the TV, it's COVID-19 everywhere. And so today, the way I look at this is our life has to go on. We have to keep on working every day, continue to do what we need to do, but just our own selves, educate ourselves about those 3 guidelines that you said, the recommendations from the CDC. But that part I wanted to share today, because we need to put that out there to our people, you know, to be able to educate, even in the schools, that we have values as a Lakota people, Lakota nation. And part of that is compassion. We need to have compassion for our people that have that, because you don't know what they're going through. So I wanted to say that today. And I've also shared that with my HHS committee. And I want to say that today, you know, that we need to get the education out there. And I'm glad that you're here today and you're providing this training. You probably can't provide the training that I'm asking for, but within the task force, they can do that. And Mr. Zephyr, you're in that background. You have that cultural background, Ms. Geigel. I mean, we need to get that piece out there to educate our people on that. So I just want to thank you for that. And I wanted to hear that. And I'm glad you said not retesting. You know, we got to be able to follow the guidelines. We know our people are vulnerable. Our population is vulnerable. We want to protect our people, but the virus is here. We tried so hard to keep it out in the beginning. We tried so hard, but now today it's here. So I just wanted to share that. Thank you.
Thank you. I just wanted to make one clarification. I said no retesting after isolating. So if you have one positive test and then you isolate for the 14 days, there's no need to retest that individual. I'm going to look up more information about those who have been exposed and who might be in quarantine but have not tested positive, about what the recommendations are for retesting for those individuals.
Okay, thank you. Yes, I understand what you meant.
Okay, great.
Isolation versus quarantine.
Yep.
So I understand, but I want our people to know that too. And I think that's what they're asking for is what's the difference here. So thank you.
Thank you.
Garfield, Steele,
Garfield Apple.
Apple. Garfield Apple, excuse me. The issue I'd like to talk about is a study that was done by the French, a French study, where the kids are not getting as much infection with each other as the adults. That study to discard. We discussed it at one of our meetings, and these studies were done by our own people, and she said they were done in middle schools where there's not very much population. So that was good information that came. And you guys are aware of the 800 students that have to quarantine in Georgia. So we use these things off the internet that we come up with and to make our own decision here. And our decision was to do virtual learning, and I think it's in order right now. I myself have been in the classroom for 33 years, and before I became a councilman, and I am old school, and I wouldn't even know how to teach virtual. So there's a lot of teachers out there that know how to do technological teaching. So some of these studies are refuted by CDC. Do you guys refute a lot of these studies? Because we read. There's a lot of us that read, and we see these studies, and we have to bring them into light because we're looking for a light at the end of the rainbow right now. So we do a lot of reading, a lot of studying, and I'm glad that we make our decisions for our people. And I think we made the right decision to go with virtual learning. And I would like to see it continued on into January. The disease has taken a lot away from our kids who want to go into the classroom. One thing I need to ask you is, would you recommend aftercare? Because our kids who are younger, a lot of them are thinking that they're punished. My mother and father ain't sending me to school. What did I do? I done something wrong, and it's having an effect on them. So there should be aftercare for our virtual learners, and if you guys could include that in your information that you give us, I think that would really be good for our people right now, because these are new things that are coming about. We've never dealt with them before, and we're dealing with them now, and we don't know how. So if you guys could look at that, and possibly in your training, when you get to the school systems, kind of bring this up, and what type of aftercare would you be looking at giving our kids and our parents, the ones who are who have had COVID and are back now? A lot of people, like Sonia said, they look down at them and they're scared of them. In any society, I would think that away from people, you're telling them, stay away from me. That's not socially right. So I would appreciate you guys, when you get to the school systems, to do an aftercare for the kids on why they can't go into a classroom setting like that. So what would you recommend?
What is the least risky in terms of if you were to provide aftercare, how could you do that most safely up to, you know, what would be the most amount of risk? So we can take a look at that. Also, in terms of studies, I just want to caution, you know, now that you can pretty much find anything you want on the internet, you can generally find information to support whatever opinion you have. And so what the scientific organizations do is they look at multiple studies and they try to take information from many different places to then provide those recommendations. And that's what CDC does. So we wouldn't take the advice of just one study, but rather look at multiple studies to try to see what what the data are saying and how to best recommend what to do based on multiple studies. So I think it's great if you go and you look for studies and you read them, just interpret them with caution if you're only looking at one study. Or if the one study that you found is very different than 5 or 6 or 7 other studies, it may have problems with its the way that it was done, or it may be not done by you know, a reputable individual. So just a caution. I think it's always good to look and to read studies, but you also want to make sure you're looking at multiple and not just taking the advice of one. Thank you.
Cora, you're next.
Thank you. I guess I have a couple of questions. My first question is, do you have any recommendations for our members who are attending the Sturgis Rally or Central States Fair or other big social events like that? Do you have any recommendation for policies that we can do or anything?
So CDC's recommendation is to avoid large gatherings. So I think that's challenging for both of the events that you mentioned. Also, our recommendation is to wear a face covering if you are going to be around many people and not able to physical distance. And I would say that based on what I've seen on the television from Sturgis, that there's not a lot of face coverings being worn. So I think that, you know, CDC's recommendations are, again, try to physically distance, stay 6 feet, at least 6 feet apart from people, wear a face covering, wash your hands, and avoid gatherings avoid large gatherings, and also avoid gatherings where individuals are not practicing those recommendations of wearing masks and physically distancing.
Okay. I think that have you read our shelter in place ordinance?
Yes.
Okay, and in our shelter in place ordinance, the only time that there is quarantining or whatever special rules that apply, it's if somebody has stayed away for more than 24 hours. But to these events, people most likely will not be staying away for 24 hours. do you have any recommendations how people or what people should do upon their return from these events? Because like you said, most people are not going to wear face coverings.
Yeah, you know, we don't provide recommendations for those kind of specific circumstances. Really, it's up to you all to decide what you think you want to do based on those individuals who do attend having an increased risk of having come in contact with the virus. But for us, again, our recommendations are to avoid those gatherings. And then if somebody thinks that they've been exposed, our recommendation is if you think that you've been exposed, to try to self-quarantine and stay away from other people. But that, again, will have to be something that you all decide what is appropriate for the tribe. Thanks.
Okay, then my next question is in regards to our casino openings. You know, we have 2 casinos, and do you have any recommendations on those openings? Like when is a good time or?
Yeah, so we recommend that every decision is data driven. So once you have a good sense of your epidemic on the reservation, you know, across the tribe, what we recommend is that there are a number of data points that you want to see in terms of being able to move from more of a shelter in place posture to one that opens up a bit more. And this is things like a downward trajectory. You're seeing a decrease in new cases over a 14-day period. That you have not, so for your hospital capacity, that it is not at a very high capacity and that there's no ability to have additional patients or limited ability for additional patients. And also that you're not seeing increases in cases, individuals coming for outpatient, at the outpatient department for appointments or the emergency department for respiratory illnesses. Also that you have testing capacity to be able to get tests done and to get the results in a quick amount of time, so less than 4 days. So if all of those things are in place, then you should be able to make a decision what businesses and things can open. In terms of the casino, we'll be going to the larger casino this week and providing recommendations about how to minimize the risk. So if it were to open, what things could be in place to minimize the risk both to employees and to any customers who come. And so we'll provide those recommendations. Again, the lowest risk is not opening the casino. The highest risk is opening it just as you would normally open it anyway. And then there are a number of things in between those two, points that can make the risk more or less. And so our goal is to provide information about what you can do to keep the risk low. And then it'll be, again, up to all of you to decide which recommendations you want to implement. Thanks.
Okay, will you also be coming to the small casino here in Martin? Or are you just planning on going to the big casino?
We just were asked, actually, I didn't know there was another casino, but we just were asked to go to the big one so far, but I'm just speaking to OE now and he says he can set that up for the smaller one if we're
okay.
We'll be happy to do that.
Yeah, we would appreciate that if you'd come to the small one. Do you have any recommendations regarding any policies that we should be implementing, or well, that, and where can I find the guidance for opening businesses like you just discussed about the downward trends and everything? Is that on your website as well?
So yes, there's guidance. It's cdc.gov, and on that webpage there is a coronavirus button. You can press that, and it can take you to the different guidance documents.
Okay.
And I also believe you are creating a reopening guidance document that has some of the criteria included as well.
Yeah, for the casinos. That's why I wanted to know where I could find that. So I don't know. I was just hoping you would have some recommendations for what we could do or what policies we need to have in place for people who are going to like the huge social gatherings. But I guess that's all the questions I have for now.
Thank you.
For you. Thank you.
John Long.
Good morning, ma'am, or good afternoon, I should say. I think Council Lady Cora kind of touched on some of the issues I was going to address. And in my position, ma'am, I tend to get a lot of calls, text messages, questions regarding things, and I try to do my best to refer them where they need to be within the tribe. But I guess, can you just reiterate, the importance of following whatever guidelines it is, CDC, tribe, whatever, because some of the things I'm hearing, and it's kind of disturbing, to be honest, I'm saying this in part to make the tribal councils aware of it, but also, and maybe seeking your input, but, how important it is for our police officers and our nurses to abide by what the tribe has in place. These are concerning stories that I'm hearing of our uniformed officers and nurses taking part in these events in Sturgis, in the upcoming fair, and quite frankly, that they're going to be in these events and come back to the reservation where we're at risk. I guess I'm just asking if you could, just reiterate, if you haven't already, the importance that, we need to take this matter seriously. And I've said it for several months now, and how important this is, for us to participate in abiding by the tribe's ordinances. Thank you.
Thank you. I think that you have been taking this seriously. I would like to reiterate, though, all of you as leaders can also set a really good example for your constituents. And so, not everybody's wearing a mask. I know you're eating, but I think there are ways also when you're out in your district, when you are, going around and you're near other people, that you also show how important it is to wear a mask. People look up to all of you as their leaders, and I think you can set a really good example for individuals in the community. And again, I think helping people understand what they can do. So it is a scary disease. Nobody wants to get it. It is something that is new and we are learning about all the time. But just again, to reemphasize that there are things that can be done. Washing hands, wearing a mask, physically distancing when possible, cleaning and disinfecting, high-touch areas like doorknobs and keyboards and things that people share, and staying home if you're sick. If people know to do that and they follow those guidelines, this disease will not take a foothold in your community. Thanks.
Thank you.
Regina Mills.
Yes, thank you again. Just real quick, I'm just glad with everything that you had said, and I just wanted to state, I think the other side to this too is our cultural component, our tradition. We're I think that that's the direction that we as a tribe has taken. So I just wanted to share that. I did have a question on if you had a chance yet to meet with the Indian Health Services, the acting CEO there, because the data points that you're referencing that we need to establish in making decisions going forward, those three things that you had talked about, the hospital and respiratory capacity, those are numbers we're going to need from our local IHS services. So have you been in discussions with them yet?
We participated on the medical task force discussions, and Sarah Jumping Eagle was part of those discussions.
Okay, because I think that's going to be key. And we had already worked out an agreement with IHS on the data sharing in this. So I hope there's not going to be any issues with data sharing from that standpoint. So that's kind of why I'm bringing that up here. And then my next question, well, it's not my question for CDC, but if the COVID director is on, Mr. Zephyr, I would really like to hear from him, you know, any kind of recommendations or something needing from us as a council, as leadership, you know, coming forward, and then being sure to report that back to law and order. Because if we are going to be moving in a direction into considering reopening of things down the road, and I know that is just a discussion happening right now. It's not something that's going to happen today. And then I just want to make sure we reiterate that, and that communication is key in our decisions as leaders. So I just want to hear from him on, you know, kind of the last couple of weeks, because he just stepped up and is taking on this huge role in trying to help guide what we're trying to do and protecting and the safety of all our people. So if I can hear from him, and then my last comment would be, again, to the community out there with our shelter in place and what Cora had talked about. It's imperative that people stay away from those places, and we just can't say that enough. And again, the ordinance says if they choose to go to hotspots, then they come home and self-quarantine for 4 days. That's our law. So I would really hope that individuals that are choosing to be, you know, make decisions like that, then they choose to come home and stay home for 14 days. So I just wanted to state that for the public that are listening, and if we can hear from Mr. Zephyr. Thank you.
Thank you. I will touch on one thing that I think will really help us make decisions. Is I passed it out, and you should have been emailed it also. Data sharing agreement between the OGLALA Sioux Tribe and the CDC Tribal Support Unit Field Team, which is the individuals that you just talked to. And it's really important that we have access to data. Since I've been in this position the last few weeks, I've been trying to get the data, and I'm having trouble myself, being the director, citing HIPAA violation, you know, citing HIPAA as the protective source. So we thought maybe we could create this data sharing agreement, and that way any concerns on how it would be used would be addressed in this data sharing agreement. So the way this data sharing agreement works is, Maureen talked about it a little bit. So when we're making decisions for the people of the reservation, we don't just take a 1-day spike and say things are going up, the numbers are going up. We take a 14-day average, and then we make a decision. Is the trend in the 14 days going up, or is it going down? And when you study charts, you understand that there are resistance points or support points. Say our support for the last 6 months might be 40 cases. Are we above that, or are we below that? Are we trending down, or are we trending up? So these are just some things that we can look at if we had the data right now. And I'm told it exists. I just haven't seen it yet. these representatives from the CDC are willing to compile all those data points for us and create the charts for us. I just need access to it and just need people who have it to feel comfortable giving it to me. And on your other question on self-quarantining, there was some talk, at least between me and Chief of Staff, on things we can do to try to deter people from going to the Sturgis rally or the fair. And I'll just say, it might not be a favorable idea, but one of the things we could do is, with the support of the shelter-in-place ordinance and using self-quarantining, that if our tribal employees were to attend these events, that possibly we consider they self-quarantine or they quarantine for 14 days without pay. It was just talking points, and we're just trying to figure out ways to discuss how do we deter people from going to these hot spots and bringing back this disease. We haven't figured it out. We haven't decided anything. Those are just some talking points.
Ryan, Deputy Eagle.
This is a question for you. So what, you never see no data on, or you rarely see data on if you can be infected again once you tested positive. And so that's one. And then the second one is, let's say there's a family. One tested positive out of the family. And instead of isolating, they exposed the whole family. But yet, that one person was the only positive of the whole family. The others still never tested positive. And it was too late to self-isolate that person because she done tested, or he or she done tested and then done exposed the whole family. So there was no need to isolate that person. And it's the virus is so contagious, but yet the whole family didn't get infected. I mean, can you answer to that? The part about if he can be infected, and about the other part.
So let me first answer your question about reinfection. So right now, so this is the latest update on CDC's webpage that there have been no confirmed cases of reinfection so far. It does not mean that it can't happen, but right now, with the data that we have, since we only know it emerged, in December, so far there have been no cases of reinfection. So that's where we are at the moment with that one. Your other question was about a family member, and I apologize, I didn't quite get that question.
Let's say, so in a family, there's one person who tested positive. One person tested positive, and he or she already exposed the whole family that's living there. So they didn't isolate this one person because they're already in contact the whole time, And here it takes about a week, in most cases about a week to get your results back after you test. So you test one day, then a week later you find out you're positive while you was already around your whole family in the household. You know what I mean? And then still this one person was the only one who was positive, and yet no one else tested positive in the family. You see that a lot, or because all we've been hearing is it's really highly contagious. But yet, in some cases that's the case. So what is can you answer that, or?
Yeah, so we don't really know if there are different levels of infection, right? Some people have mild cases, some people have no symptoms. Some people die, right? So there's a range of symptoms that individuals have. And we don't yet know why some people are asymptomatic and why, some people die. We found that some people are at higher risk, those with underlying health conditions, those who are of older age. But we're learning more and more all the time. So we just don't know yet. But if somebody has symptoms, they should wear a mask. We do know that wearing a mask is very effective for source control, meaning that if you're infected and you have a mask on, you have much less chance of transmitting to anybody else. So in a situation where somebody's been around their family and they test positive, if they have the symptoms, they should be wearing the mask, even at home. Because if they can't isolate, if the home is too small, if they're they're around lots of people, they should be wearing the mask. If they haven't been and they test positive, they should then start wearing the mask. If they can't, isolate, then they can at least wear the mask to try to protect the rest of the family. And then those individuals who are family members should consider a quarantine, right? Trying to be away from that individual, even so for the 14 days, so that then they don't become positive. Because even if they have been around the individual who was positive for 5 or 6 days, there's still the opportunity for that person to transmit beyond those initial few days. So they should still try to, that person should try to isolate, or the individuals try to be away. If that is impossible, who has the illness should wear a mask and should be kept away from the others as much as possible. And a lot of cleaning and disinfecting, hand sanitizer, physically distancing as much as possible. But I can't overestimate the mask. Masks are very effective. And even the cloth, ones that people are making at home are effective in keeping the virus with one individual and not passing to others.
So I was just looking at the news, and Governor Cuomo from New York State, he put a no travel to South Dakota. Residents from New York State. Is there a way we can get you to go talk to our governor and tell her how important masks are and social distancing? Just because she, like you said, political. She's trying to please the redheaded man up there in DC, the orange guy. But and I hope she's listening. But thank you again for coming.
Thank you. I can put a recommendation into CDC director to try to be in touch with the governor. I don't know where that will go, but I'm happy to do that. Also, just in thinking about the data, South Dakota is showing an increasing trend right now. So many states are in a process of the 14-day decline. So as I mentioned to all of you, for the tribe, looking at the 14-day average and whether or not you're on an increase or decrease is going to be important for you to be making decisions. We're doing the same thing on a state-by-state basis at CDC. So we look at state-level data about increasing or decreasing trends. And then we look at the county level to try to see how we might be able to help individual counties or individual states with their epidemic. And South Dakota, unfortunately, right now is in an increasing trajectory of cases. So that includes the entire state. I don't know, county by county what the situation is, but as a state, it's one of just a few states right now that are on an increasing trajectory.
Cindy.
Cindy Gallego.
Hey, good morning, everyone. For the record, my name is Cindy Gallego. I was just listening to the comments and opinions of everyone here, and I know that in regards to Sturgis Rally and the Central States Fair, I really have to express my concerns with the non-essential travel that people are taking to go to the rally and going to, or in the future may possibly to Central States Fair. I expressed this over and over and over again that we are not and will never be fully prepared for a increase in the number of the virus here on our reservation. The direction that the state of South Dakota is going with the Sturgis Rally being opened up and these fairs within close to our proximity is really concerning for me. And I know that many of you as council members have expressed this concern. I have several text messages and emails from individuals, whether they're employees or just tribal constituents, that they're concerned because our frontline employees, our first responders, our nurses, different things like that are going to these areas and then coming back, and they won't know if they're positive, not for another 7 to 14 days, and they could be working with our tribal people, whether that's law enforcement, ambulance service, our frontline people at our hospitals and different things like that. I feel like at this point, we don't want to talk about it. And Mr. Zephyr talked a little bit about it as well, but I think it's within the tribal council's purview to establish some basic rules for engagement as far as our tribal employees and our tribal people go, because we're not only putting at risk in an infection, but we're also putting at risk our response. Right now, we are truly struggling. If we have individuals that are placed into quarantine for 14 days, and there are nurses, if there are law enforcement, if they are our ambulance service, if they are any employee that provides basic life necessities to our tribal members, things are going to slow down as it is with everything that's going on with our tribal people. We struggle responding to emergencies as it is, and if we have an outbreak because of Sturgis Rally, then we are really it's going to be even harder. So I know that it was just a talking discussion between Mr. Zephyr and myself, because we received notification that the Rosebud Sioux Tribe Ambulance Service has issued notification to its employees that if they should travel to Sturgis Rally, that they will be placed into quarantine for 14 days, and it will be without pay. I know that earlier on the onset of all of this, we banished an individual for knowingly traveling to known hotspots. Well, South Dakota is officially becoming a hotspot. We are officially having an uptick and I think that as tribal council, you all have that power to protect our tribal people. You all understand where we stand, and I agree with you guys. We shouldn't um, um, fear or place fear in regarding this virus, but yet we do. Um, because I know, for instance, we did have one of our employees that did live and work with COVID positives, and he stayed with them for 5 weeks, and he never once tested positive. So with the right precautions and everything else like that, we're able to do that. But it appears as if the participation in the Sturgis rally, those precautions are not being made. So I implore tribal council, if there is anything that you are able to do. I know that the ordinance does say that all tribal employees have to abide by the tribal laws. That's a part of our policy procedures, and our shelter in place ordinance supports that. But I feel like tribal council, what you say will be listened to. So with that, I just needed to say that and reiterate that. And also the second piece of what I wanted to say is that data sharing agreement that was sent out, I really would like to see that be put in place as well. Thank you.
Nakina Mills.
Sorry, I was just gonna ask the attorney if they had a chance to look at that data sharing agreement and if there was any recommendations. And then also to ask the attorney to advise us on the possible recommendation that the chief of staff had just mentioned. And I do agree with much of what she had said. As a tribe, when we sent that first message about banishment and scared, and so I think those are definitely things like we as leaders are trying to get individuals and our people to understand that's not going to happen. You know, we want people to work with our COVID and contact tracing. But yeah, so if our attorneys could respond to that, thank you.
We will this is Jennifer. We'll certainly look into everything and see what our options are.
The data agreement though, do we need to pass it at our council, or can that be done at law and order?
I think any agreements like that probably need more official action than a committee.
Okay, so then I guess if you can take a look at that, and then because we do have several other things on the agenda, and then if we need to take action, we could decide to do that with your recommendations. Thank you.
Richard Greenwald. Richard.
Chair. Thank you, Chair. Can you hear me? Can you hear me, Chair?
Can hear you.
Okay. I just wanted to make a couple comments. I know that the story that Ryan was talking about, those individuals were fortunate, you know, because across the nation there were other stories and other scenarios that were mom, dad, their two sons, all in one home passed away from the COVID, and the only one that was left that survived that whole family was the thing. So I don't want us to think that because responding to Cindy, you know, you have a lot of employees that put a lot of pressure on us to not. A lot of them don't. And
Can't hear him.
you know, right
Shoot, we can't understand what you're saying. Your connection's breaking up.
a lot of this goes back to person. Can you hear me now?
No, you're
Can you hear
breaking.
me, Chair?
Okay, there you go.
Okay, this is good.
Try again. Oh, we lost him.
Your end or my end? Because I'm in good cell service.
It's not our end because we're not glitching or anything.
Can you hear me okay?
Now we can.
What I was saying was to Ryan's scenario that he talked about where the family was fortunate that the COVID didn't spread within. There's also scenarios across the country where, you know, a mom, a dad, two sons all died in one household, one family. The only one that survived was their little sister, and so she's kind of orphaned now. So it is really serious. I mean, maybe they were taking, you know, precautions at that house, or they maybe were wearing masks, or maybe they kept themselves in the bedroom or something, and that's why everybody else didn't catch it. I don't know, but I do know that this has wiped out whole families in some scenarios. You know, like this one scenario a couple months ago, where the only one left is the girl. But and then going back to Cindy, what she was talking about, we get a lot of pressure from our employees. They don't want to go back to work, so they put a lot of pressure on you and us to keep things shut down, and being shut down puts a lot of pressure on our members. They can't go out and get the things that they need for their daily lives and their businesses and whatever else. You know, so I think the main thing is to educate our people, and to also follow the guidelines that the CD has set forth before us. You know, that seems to be working really well for us. You know, when you start talking scary like you're talking, Cindy, it gets the council in a bunch, and pretty soon they're talking about shutting down the tribal borders again, which doesn't work, Cindy. That does not work. You know why it doesn't work? Because you still have employees that live in Rapid City who are all going to the rally, who are all going to the fair, who are going all over the place. And guess what? They're come back to work the following Monday, and guess what they're doing? They're all over the place, working with all of our tribal members, visiting their relatives. So it's impossible to shut down our tribe realistically. What you're doing is you're shutting down and you're oppressing the ones that are here, that are following rules, that when they do go to Walmart to get their groceries, they're wearing masks, that are washing their hands, and that are keeping safe. We oppress our own people when we do that. It's hard to say, tell people not to go to Deadwood because they're going to go anyways. We have numerous points of entry into our reservation that a lot of you that don't have never been in the partying circuit, that didn't go out and party when you're younger, you know, all you know is the highways that come in and out. There are dirt roads, there are roads that you go across a fence and you're off the reservation. We can't hold everybody down here on our reservation, but what we can do is educate them. And what we can do is provide them PPE. And I've been saying that for a long time. Our people should be able to go to the district and pick up a box of masks, some cleaning supplies, different things like that. But right now they can't. They have to either go call one of us or they have to call emergency management. Hopefully they could get some. But while we have this money, we should be stocking our districts up. So anybody that needs masks, that anybody that needs cleaning supplies, anything like that, hand sanitizer, they can come pick some up to get people all in a bunch and then start talking shutdown again. You're oppressing the people that are here, and you're not stopping it because there's too many people that live off the reservation. You're allowing to come back, and people traveling through the reservation, you're not stopping that unless you're going to do a complete lockdown and shut down every border, put a cop there, barricades up, nobody in or out, have somebody watching them back dirt roads I was talking about. Our party roads, I could go right across White Clay Dam into Nebraska if you shut down. I could still do that. There's nothing to stop me. But when you start talking about lockdowns and stuff like that, you oppress the ones that are here that are trying, and there's those that don't even go nowhere. They stay home and they're trying. But I really.
People act recommendations on what to do, open casinos and so forth, or going to the Sturgis rally. It's self-discipline. We don't need to go over there. As a common sense, we make that determination. I was just talking to the chief of police, and he indicated that they developed a protocol for DPS. If you go to Sturgis rally, you're going to have to quarantine yourself for 14 days. That's the requirement. Programs have ideas and protocols that they've established. And they're doing the best they can to cope with the issues regarding this matter. So I want to thank you. I think we can sit here all day, discuss all the protocols and so forth. I think it's really self-discipline, and you provide some information that is pretty helpful to us that we can use. It's ultimately, it's up to us to implement this. So I want to thank you.
Thank you, Mr. Yellowhawk. That's it.
Do you wanna finish off with last comments or anything for all of us, I guess? Thank you.
Yes, please. I just want to thank you all again for having us here, for all of your hard work, for your own community, and for working to combat this disease. We're committed to helping in any way we can to support what you're already doing. You know, some of the guidance isn't as self-explanatory as others, right? So a lot of what I talk about, the wearing of masks, washing hands, all of that's pretty self-explanatory. But some of the guidance that we put out for schools, for example, there's many pages. It has a lot of nuance behind it. So while we're here, we want to try to help you all to do what you think is right for your situation. And so if we can help interpret some of that guidance in any way, that's what we're here to do. So I neglected to introduce the rest of my team here when I first got here. So if you don't mind, just one extra minute so I can introduce the rest of the team. They are amazing individuals who have been working really hard, us as a team, to really assist in every way. I have Melissa Edmondson here. She's an industrial hygienist from the National Institutes of Occupational Safety and Health. She'll be working a lot on these walkthroughs, you know, trying to make sure that we can provide assistance. Yeah, come on up. Trying to make sure that the recommendations that we have, that we provide, allow you to make the best decisions possible. Sure.
Hi, everyone. Again, my name is Melissa Edmondson. I specialize in worker safety and health. So myself and Seth will be conducting a lot of the walkthroughs, like Maureen mentioned.
Next, we have Seth McCormick, also another industrial hygienist, and he can say hello.
Yeah, I'm going to be assisting Melissa, and we're doing walkthroughs, and happy to help however you guys request. Thank you.
And last, we have Lindy Liu. She's an epidemiologist, also mostly focused on the contact tracing and case investigation.
Hi, everyone. Thank you so much for having us, and looking forward to continue working with you all.
Great. And my background is epidemiology and global health, and also working just to bring all of this together, and really appreciate the opportunity to work with all of you and to learn not only about what you're doing for COVID, but to learn a little bit about your traditions and your tribe. Thank you for providing that to us, and we've really appreciated being able to be here with you. Thank you.
On to the OST Land Committee.
Oh, thank you, folks, for being here, sharing a lot with us, and listening to a lot of our how would I put that? A lot of our words focusing on this epidemic, you know. But I just want to thank everyone for being here today. And we're moving on to the OST Land Committee. First on the agenda, the OST election code.
Thanks, Mr. Chair. There should be a ordinance to read, I guess, if I could have the secretary read it for passing. Thank you.
Because there's a lot of changes, or some changes in there, I'm gonna ask the attorney to read the ordinance.
Okay, that'll work.
Verify the changes. Jennifer?
Yes. Yes, I can read that. Okay, ordinance of the Oglala Sioux Tribal Council of the Oglala Sioux Tribe, 13. Whereas the Oglala Sioux Tribe adopted its constitution and bylaws by referendum vote on December 14th, 1935, in accordance with Section 16 of the Indian Reorganization Act of 1934, codified as amended at 25 USC Section 5123. And under Article 3 of the Constitution, the Oglala Sioux Tribal Council is the governing body of the Oglala Sioux Tribe. And whereas Article 4, Section 1K of the Tribal Constitution vests the Tribal Council with the authority to promulgate and enforce ordinances governing the conduct of persons on the Pine Ridge Indian Reservation. And whereas Article 4, Section 1W of the Tribal Constitution vests the Tribal Council with the authority to enact laws protecting and promoting the general welfare of the tribe and its members. And whereas Article 7, Section 2 of the Tribal Constitution vests the Tribal Council with the authority to enact ordinances governing tribal elections. And whereas in the exercise of these authorities, the Tribal Council has adopted the Oglala Sioux Tribe Election Code to establish a uniform and comprehensive election process that is fair, impartial, and dignified for the election of members of the Tribal Council, boards, and district government officials. Ordinance number 23-13, February 25th, 2020. And whereas on August 10th, 2020, the Land Committee of the Tribal Council approved a motion to clarify the manner in which background checks will be conducted for candidates for elected office, and amendments proposed by the Land Committee are set forth herein. And whereas the Tribal Council concurs with the amendments proposed by the Land Committee. Now therefore be it ordained that the Oglala Sioux Tribal Council hereby amends the definition of the term background check in Section 4 of the Oglala Sioux Tribe Election Code, Ordinance number 20-13, February 25th, 2020, to read as follows, with additions underlined and in bold and deletions in strike-through. Shall mean the submission of prospective candidates' fingerprints, date of birth, social security number, all previous names used, all states lived in, and other pertinent information in order to review the tribal, federal, or state criminal history, if any, of any candidate for tribal or district office, membership on a board, commission, committee, or the position of chief judge of the tribal court. The criminal background check shall be conducted by the Election Commission. Be it further ordained that the Oglala Sioux Tribal Council hereby amends the first paragraph of Section 14B of Ordinance number 20-13 to read as follows, with additions underlined and in bold and deletions in strike-through. Criminal background checks and drug tests for candidates. All candidates for tribal office shall submit to a criminal background check, which criminal background check will be conducted by the Election Commission and will include tribal, state, and federal records and a drug test. Any candidate who is taking doctor-prescribed medication which would result in a positive test must submit an official document from their doctor which legally prescribes the medication. All drug test results must have a medical review officer's MRO explanation of the results. The Election Commission shall rule on the eligibility of each candidate based upon the results of the criminal background check, drug test, and other requirements for office. The Commission shall only accept the initial results of a candidate's drug test. All candidates will be solely responsible for all costs and fees associated with obtaining their criminal background check and drug test. Be it finally ordained that the foregoing amendments shall go into effect immediately. Certification.
Motion.
Motion by. Have a motion by Mr. Yellowhawk. We have a second.
Second.
Second by Chancey Wilson. Roll call.
Dwayne Yellowhawk,
Yes.
Garfield Apple,
No.
Glenn Gibbons,
Yes.
Lydia Bearkiller,
Yes.
Sonia Little Hawk Weston,
Ha,
Jackie Sears,
Oha.
Vincent Tulance,
Yes.
Craig Gillen,
Yes.
Cora Whitehorse,
Yes.
Valerie Janice,
Yes.
Valentina Merdanian,
Oha.
Ryan Jumping Eagle,
Yes.
Bo Little White Man,
Yes.
Chancey Wilson,
Yes.
Philip Goodcrow,
Yes.
Randy Laisbeth,
Yes.
Richard Greenwald, Richard Greenwald, Nikina Mills,
Huh.
A vote of 16 yes, 1 no, and 1 not voting. Motion carried.
Okay, thanks, Mr. Chair. The next one was the utilities assistance. I don't believe there was a resolution for it, but we need to extend the deadline. The deadline today was actually today, and the motion was to put it back on council floor to extend the date out for people to have ample time to get their applications in. And so it's here on the floor to extend the deadline.
Chancey, there's actually a ordinance from the attorney. Jennifer
Well,
drafted on
that's
a
even that's even better then.
Maybe she can read it.
Yes,
Yeah,
I can do that.
that works.
Okay. Ordinance of the Oglala Sioux Tribal Council of the Oglala Sioux Tribe, an unincorporated tribe. Ordinance of the Tribal Council of the Oglala Sioux Tribe, amending Ordinance 20-49, the OST COVID-19 Extended Emergency Assistance Program, in order to extend the deadlines to submit an application. Whereas the Oglala Sioux Tribe adopted its constitution and bylaws by referendum vote on December 14th, 1935, in accordance with Section 16 of the Indian Reorganization Act of 1934, 25 U.S.C. Section 5123. And under Article 3 of the Constitution, the Oglala Sioux Tribal Council is the governing body of the Oglala Sioux Tribe. And whereas Article 4, Section 1F of the Constitution of the Oglala Sioux Tribe authorizes the Oglala Sioux Tribal Council to manage all economic affairs and enterprises of the Oglala Sioux Tribe, and Article 4, Section 1W authorizes the Oglala Sioux Tribal Council to adopt laws protecting and promoting the health and general welfare of the Oglala Sioux Tribe and its membership. And whereas on March 10th, 2020, the president of the Oglala Sioux Tribe declared a state of emergency for the Pine Ridge Indian Reservation, and thereafter the Tribal Council affirmed the president's declaration of a state of emergency on the reservation due to the coronavirus 2019 COVID-19 global pandemic. And whereas, in response to the COVID-19 pandemic and the risk posed to the health and general welfare of residents of the Pine Ridge Indian Reservation, as well as those who live nearby and work on the reservation, the Oglala Sioux Tribe established a COVID-19 task force to address the pandemic, activated its emergency management plan, and enacted several ordinances and resolutions to address the COVID-19 pandemic, and to take public health precautions for prevention and containment of COVID-19 on the reservation, including but not limited to a shelter-in-place ordinance, curfew ordinance, and public health checkpoint ordinance. And whereas Congress enacted several laws responding to the COVID-19 pandemic, including the Coronavirus Aid, Relief, and Economic Security Act, CARES Act, Public Law 116-136, March 27th, 2020, which established a Coronavirus Relief Fund, CRF, and appropriated $150 billion to it for fiscal year 2020, of which $8 billion is reserved for tribal governments. And whereas on April 22nd, 2020, the U.S. Department of the Treasury issued Coronavirus Relief Fund guidance for state, territorial, local, and tribal governments, and updated it on June 30th, 2020. hereafter Treasury guidance, and on May 4th, 2020, the Treasury Department issued Coronavirus Relief Fund frequently asked questions, hereafter Treasury FAQs, for recipients of payments from the CRF and updated it several times. And whereas the Treasury guidance and Treasury FAQs identify non-exclusive categories and examples of eligible expenditures under the CRF, including expenditures in the areas of medical expenses, public health expenses, payroll expenses, public health measure expenses, and economic support expenses, and other COVID-19 related expenses reasonably necessary to the function of the tribal government that satisfy the CRF's eligibility criteria. And whereas the CRF funds have been released to tribal governments, including the Oglala Sioux Tribe, and whereas the Tribal Council of the Oglala Sioux Tribe enacted Ordinance Number 20-43, July 1st, 2020, to adopt the Oglala Sioux Tribe Coronavirus Relief Fund payment budget, and further amended by Ordinance Number 20-48, August 5th, 2020. And whereas the Tribal Council continues to work on the CRF payment budget to ensure that it meets the needs of the Oglala Sioux Tribe and its citizens during the COVID-19 public health emergency. And whereas Treasury's guidance states that eligible expenses include, quote, expenses associated with the provision of economic support, end quote, to businesses, including but not limited to, quote, expenditures related to the provision of grants to small businesses to reimburse the cost of business interruption caused by required closures, end quote. And whereas the Treasury FAQs state in relevant part that, quote, Coronavirus Relief Fund payments may be used for subsidy payments to electricity account holders to the extent that the subsidy payments are deemed by the government to be necessary expenditures incurred due to the COVID-19 public health emergency, end quote. And the Treasury FAQs further provide that, quote, if determined to be a necessary expenditure, a government could provide grants to individuals facing economic hardship to allow them to pay their utility fees and thereby continue to receive essential services, end quote. And whereas by motion and vote on August 5th, 2020, the Tribal Council approved Ordinance Number 20-49, the COVID-19 Extended Emergency Assistance Program for electricity, propane, wood, and rent assistance for residents of the Pine Ridge Indian Reservation to ensure compliance with the tribe's mandatory shelter-in-place and stay-at-home orders to prevent the spread of COVID-19. And whereas the Tribal Council has determined that it is in the best interests for the health and general welfare and the protection of its members to amend this Ordinance Number 20-49 in order to extend the deadlines therein to allow for more time for tribal members to apply for the program. Now, therefore, be it ordained that the Oglala Sioux Tribe does hereby amend Ordinance Number 20-49 as follows. 1. The deadline set forth in Section 4B shall be extended from August 11th, 2020 to August 31st, 2020. All other dates in this Section 4 shall be amended to reflect this change. 2. The dates in Section 7 shall be extended by 1 month. 3. Due to this extension of deadlines, payments for August, inclusive of July, may be made in September or October. Tribal members are reminded of their responsibility to pay their utility and rent bills. 4. No payments shall be made after December 30th, 2020. Be it further ordained that this ordinance shall take effect immediately and shall supersede, repeal, and replace all prior inconsistent laws of the Oglala Sioux Tribe. Certification.
A motion by Ryan Jumping Eagle, second by Randy Lathbat. Roll call vote.
Dwayne Yellowhawk.
Yeah.
Garfield Apple.
Yes.
Glenn Gibbons.
Yes.
Lydia Bear Killer.
Yes.
Tonya Little Hawk Weston.
Ha.
Jackie Peters.
Uh-huh.
Vincent Tulance.
Yes.
Craig Dillon.
Yes.
Cora Whitehorse.
Yes.
Valerie Jenkins.
Yes.
Valentina Merdanian.
Uh-huh.
Ryan Jumping Eagle.
Yes.
Bo Little White Man,
Yes.
Chancey Wilson,
Yes.
Philip Goodcrow,
Yes.
Randy Laisbad,
Yes.
Richard Greenwald,
Yes.
Nikina Mills,
Huh.
We have a vote of 18 yes, 0 no, motion carried. We have a motion to adjourn.
Motion.
Got a motion by Mr. Dillon, second by Mr. Laisbad and Mr. Goodrow. Roll call.
Nikina has her hand up.
Tina.
Yes, are we gonna decide to do the data sharing thing? If we're gonna be moving forward and looking at data and using data forward, I think it's imperative that we decide to do that. If not, then another virtual. But then my next question is health admin Dolores Puyer, if she's on, and if we need to go through that process through the research and review board. Or maybe Cindy knows. I see she's on, health admin is on. Before we adjourn today.
Could we take that to law and order? Nakina, discuss it there?
Okay, I guess if that's.
Yeah, because it's under the law and order, the COVID task force.
Okay, I just worry like CDC is only here another 10 days. So if we're trying to get data and charts and things established and going, then I think we need to try and do this sooner than later. So just share it. Thank you.
Tomorrow's law and order.
Okay, so that'll be done in law and order.
Okay, that will be done in law and order. We'll go ahead with roll call vote.
Dwayne Yellowhawk,
Yes.
Garfield Apple,
Yes.
Glenn Gibbons,
No.
Lydia Bearkiller, Sonia Little Wilson,
Huh?
Jackie Sears,
Uh-huh.
Vincent Tulance,
Yes.
Craig Gillen,
Yes.
Cora Whitehorse,
Yes.
Valerie Janice,
Yes.
Valentina Merdad,
Uh-huh.
Ryan Jumping Eagle,
Yes.
Bo Little White Man,
Yes.
Chancey Wilson,
Yes.
Philip Goodcrow,
Yes.
Randy Laisbad,
Yes.
Richard Greenwald,
Yes.
Nikina Mills,
Yeah.
We have a vote of 15 yes, 2 no, and 1 not voting.
meeting adjourned at 1:02.
Meeting is adjourned at 1:02. Thank you, Council. 1:03.